Hi, I'm Jana Tarjev, family nurse practitioner that focuses on functional medicine approach. And I would like to continue discussing the topic of synthetic thyroid hormone. So for some people, natural thyroid hormone is not an option because of the price, because of the negative reactions they had. But their labs show that they definitely need, and their symptoms too, that they definitely need T4 and T3. What are our options? The first option, probably the cheapest one, would be to get a prescription for levothyroxine separately. It runs usually in micrograms, so 100 micrograms, 125 micrograms, depending on what you need. And to get a prescription for Cytomel, or generic would be liothyronine. It's not very expensive, even without insurance. So liothyronine is T3 only medication. So then you can take both of those medications and mimic kind of T4, T3 production by your gland, thyroid gland, by your body. So, but if for some reason you have some reaction to fillers, for example, levothyroxine used to have, I'm not sure right now, I have to double check, but they used to put, and also depends on the manufacturer. Again, it's generic, so it depends if one manufacturer adds some fillers, the other may not. It used to have gluten and lactose, so in small amounts it may not be a problem, but if you have celiac disease or very severe non-celiac gluten sensitivity, or for Hashimoto patients, it's advisable not to have gluten in their diet, especially if they see their antibodies go down with gluten avoidance. In this case, if you cannot tolerate levothyroxine, you can use compounded T4, T3 medication. I did talk to one of the local compounding pharmacies, and they do use a filler, which is called cellulose. It's kind of hard to break it down, so they use filler to make like a bulk of the T4, T3 compounded, and also they can use it in the sustained release formulation. Well, sustained release formulation is more expensive than the rapid release. I would start with the regular rapid release compounded T4, T3, and if you cannot break down cellulose or you cannot digest it, your stomach is not, in most of the thyroid patients or Hashimoto patients, doesn't matter, they have problems in issues with the thyroid, with the gut absorption and breakdown and assimilation. So in this case, you can ask your doctor or healthcare provider to write the prescription for T4, T3 compounded with the Acidophilus. So Acidophilus is a bacteria, like Lactobacillus acidophilus is a good bacteria that inhabits in our digestive tract, and you can try using T3, T4 in such a manner. Personally, I tried T4, T3 with cellulose, but my symptoms were very I got hypothyroid right away. Within 2-3 days I could tell something was wrong. So in this case, I switched myself to Armor, and next time, if I do decide to experiment with T4, T3 compounded, which the price was pretty good, $25-30 per month for compounded medication in one of the local pharmacies, you cannot beat that. Armor without insurance costs around $45 a month, even with good RX. So see what your options are, see what you can or cannot tolerate. Experiment. Don't be afraid to ask your doctor or healthcare provider for all the available options, and also support your thyroid with vitamins and nutrients, selenium, zinc, vitamin D, B vitamins. They are all important for thyroid hormone production, and don't forget iodine. But on the high doses of iodine, I will share my experience a little bit later. If you have any questions, please comment under this video. I would love to answer your questions, and give me some suggestions what you would want to hear about in the next video. Bye.